January 19th, 2019, and this is going to be most likely a small set of videos documenting my journey with chronic pain, leading up to the potential of spinal fusion surgery. And I have gotten so much help over the last 6 months from folks all over the world willing to share their stories, willing to let me text them, DM them at all times of the day and night about their journeys with chronic pain, and specifically in the back, and just what they've been through, and where they are now, and things that they wish they had known before and during and after the spinal fusion surgery. So I've been battling with chronic back pain for the better part of 6 years. Was told by 2 prominent surgeons in the Central Florida area at the age of 43 that any type of surgery would just be way too dangerous. It was a surgery with all kinds of crazy risks. Anytime you're operating on the spine, you could imagine what could go wrong. And so to make a long story short, it was you should just be in the hands of a pain management doc and try to live your life the best you can on pain meds. It was about where they left it. So as you might imagine, when you see 2 people that tell you the same thing, you think to yourself, good grief, I'm not going to go under the knife if these guys, these pros in their field, say that it's not something you should do. So I go down the the pain management journey for chronic pain, and I see a very good pain management doc here in the Central Florida area, and he's very conservative, so he's not a guy that's just wanting you to pop pills to get through the day. And I went through all the series of shots that you can get in your bag, from epidurals to steroids to whatever. I was willing to try anything. And any of you that have gone through any type of chronic pain scenario that you suffer from daily, you understand some of the desperation that goes along with that, and that you pretty much are willing to try anything if it means that you could get a day without pain. I haven't had a day without that in the last 6 years. So obviously I was willing to try anything. None of it worked, unfortunately. So we basically hit a wall and ended up with a mild form of an opioid patch for me to wear. It's where is it? Yeah, that's the one that I just put on. I change them out every Friday. They're 7-day patches so that it slowly releases a mild form of an opioid into your bloodstream, and hopefully alleviates some of the pain. And it obviously does. It enables me to get through a day, but I will tell you that there are no moments in the day that I don't have and deal with the pain in my upper thoracic back. It's just a matter of how bad it is from a 1 to 10 during the course of the day. And the whole reason for my pain and what it's emanating from is something called Scheuermanns Disease, which is a disease that usually starts in your youth and most of the time goes undetected, as it did in my case. And your vertebrae are always pretty evenly rectangle shaped on top of each other, and they just stack in the spine's natural curve. With Scheuermanns disease, what happens is your vertebrae grow in a wedge. So basically, there's your wedge right there. So now you're stacking wedges on top of each other, And obviously, when you have wedges stacked on top of each other, you're eventually going to get this very nice, very pronounced curve in your upper back. So you start to walk around looking like you're a humpback, and you can't control it. And it's very painful to try to keep yourself upright. It sounds really basic, but it's what it is. As the surgeon that I'm seeing now tells me, as soon as I stand up on my feet, I'm eventually fighting my body's natural tendency to be bent over. Everybody, as they age, starts to bend forward a little bit, a tiny bit, not much at all. So by the time you're 70, 80, 90 years old, you've got this natural curve to use. So what I wake up and I'm already way bent over. So for me, just to take my shoulders back and actually walk around with my shoulders pulled back is automatically just flexing every muscle that's back there connected to the spine. And if you study the spine at all, there are layers of muscle that are attached to your spine. So basically what I'm doing is those things are strained to the max every minute of the day that I'm upright. That's why the only way I ever really get relief is lying down on an ice pack. So that's my situation. I've already got this curvature that's huge, and therefore the pain is just something that's it's never going to go away. So it's in the pain management world, it's a matter of finding the best form of treatment that can get me through the day. And I as of about 6 months ago, have been experiencing more and more pain on a daily basis, to the point where it's just that if you haven't been through any type of chronic pain, it's hard to understand what people tell you, but what it does to you mentally and emotionally is hardcore. It is hardcore when you hurt. Period. I don't know how else to put it. Your body is an amazing machine, and it can fight a lot of stuff on a daily basis, but it doesn't mean that it can't hurt. And basically, you get to the point where you're doing everything you possibly can just to make it through a day. So it was getting to the point, and where it is now, and why I'm doing this video, and why I'm doing all the research on surgery, that I barely make it through a work day. And when I do, I come home, I crash on the bed, and I lay down just to get that relief on my muscles that have been straining, just to be laying there for a while. And an ice pack is always nice as well. So, and you're talking to a guy who has been going to the gym 5 or 6 days a week for the better part of his adult life, and likes to stay in shape, likes to stay active. I've got a young family, so there's plenty of motive on my part to stay healthy. So to be at this point that I'm at now, and to basically, if I make it to the gym once or twice a week right now, I'm lucky. So that's so not where I want to be. And that's what's caused me to go out now and get some other opinions on what can be done about this, and if technology has changed in the medical field when it comes to spinal surgery and things of that nature. And I have found somebody here in Central Florida that was recently brought in from the Cleveland Clinic, which is one of the best teaching hospitals in the country. And he ordered a few more tests, and he basically is like, I've fixed much worse than you. Which was like, wow, are you kidding me? The first person that sat in front of me and was like, we can do this, didn't mince words in the fact that it will be hell on earth for a while to get through something like this, and that there are major risks involved with a spinal operation, but that the only other alternative is to drug yourself up to another level to keep getting through the day, and that eventually the curvature will continue and it will start to affect the other form of vertebrae in your back. So he didn't make the outlook of not proceeding surgically a very enticing one. He did say obviously it's not an emergency because you're still functioning. They won't do this operation on folks that aren't in decent shape, and if you're suffering from other major health ailments, they won't do this surgery either because it's very, very taxing on your body. I'll try to plug some pictures into this video once I'm done with it to give you an idea, A, of my curvature, B, of what the surgery entails, because I mean, basically you look like a version of the Terminator. With the amount of steel that you have in your back, it's probably along the line of 20 screws that are screwed into your pedicle vertebrae, and 2 titanium rods that will then go down, and this would be between my T2 and T10, which is the thoracic part of your spine. You've got your cervical towards the neck, your thoracic in the middle, and then your lumbar down towards the bottom, which meets your sagittal S1. So mine's right up there in the middle. So it's the most dangerous part to be operating on because it's the most tender and most touchy part of the spine to be working on when it comes to messing with the spine. So the spine itself and what can happen. So anyway, that's what he is basically recommending that I get done. So he'll take wedges out on the back side of my vertebrae, since the front side of my vertebrae is wedged to make that curve that I explained. He'll basically take wedges out of the back side of my vertebrae so that once the 20 screws are in and the 2 rods are in, they basically just wrench those screws back up and tilt your spine and keep it straight. So when they say a spinal fusion, they mean it. They mean that all T through 10 or 8 vertebrae will then be fused together without any movement. So obviously you can imagine what that entails. The surgery takes about 6 to 8 hours. You're in the hospital for a week. You spend time in the ICU. You lose half the blood in your body as you go through this surgery, and that's if everything goes well. Obviously there are risks. This guy's got a great track record. I flat up asked him straight up, have you ever paralyzed anybody? I mean, I'm not going to beat around the bush, and he said so far, knock on wood, that he hasn't had any accidents like that. Now granted, I still have a lot more questions to ask him, but right now, this is video number 1 and just the explanation of chronic pain, which many people deal with, and many people deal with chronic pain in the back. Scheuermanns disease is a little less common. Severe kyphosis is another word for it, which is a little more common. So I wanted to put this in video format, and I'll put it out there on YouTube and on a special channel that focuses in on the topic matter, because it has been so helpful to me. I just spent hours communicating and listening to others that have gone through this. I'm a big believer on doing as much research as you can and planning as much as you can for what to expect during every aspect of this journey. I'm also working on a second opinion, obviously, but you'll find that this specialty is not something you will find in every city. So we're actually very fortunate here in Central Florida to have somebody that can actually tackle a severe back issue and surgery like this. So that about covers where I am today. The next step will be a second opinion. We'll be pursuing any other non-surgical options with my pain management doc that we may have missed. I don't want to start popping pills or anything like that to get through each day, so in my mind that's really not an option. It'll just be if there's something we've missed along the way that could be alleviating some of this pain. But more than likely, if I had to guess, it's going to be me figuring out what doctor and when to do a surgery like this. And as you might imagine, they also won't do this surgery without an incredible support system. So you better have a lot of family and friends that are willing to take care of you, because you are incapacitated. You can't do squat. It will take everything in you just to get up each day and move around for maybe 5 or 10 minutes. So getting to the bathroom, eating, drinking, changing, I don't even think you can shower for a week to 10 days. All of that, you're useless, and you're going to need somebody keeping a really close eye on your pain meds and your temperature and making sure you don't have an infection, and you just name it, the gamut. So there's a lot of factors that go into a doc even deciding that he's willing to put you through a surgery like this, which totally makes sense. With the way pain messes with your head, which I'm very, very familiar with now, the last thing you would want to do is send somebody home after a major surgery like this and have them laying there in the more pain than they've ever had in their lives, and not having anybody there to comfort them, take care of them, call 911 if necessary, whatever it may be. So I'm hoping that my video will help out just a few people as I move through this, because I've been helped in a big, big, big way. So I tend to become more cynical of social media the further we go along down that path, and that it's more bad than good. I will say that this is an area of social media that I noticed a ton of good can take place, and specifically YouTube and hashtags on Instagram, because people are really, really good about hashtagging the surgeries, chronic pain, back pain, and things that they've gone through, and even a lot of surgeons across the country and across the world. I mean, I follow surgeons in Israel and Turkey and the United Kingdom, Los Angeles, California, that are literally dialoguing with me as obviously they're being very careful as docs and HIPAA and what they say, but these are folks that are encouraging me, answering questions that they can, sharing cases that they're going through, success stories, some even stories of when things don't go the way they want them to go. But all in all, a major, major positive, and something that we would have never been able to do 20 years ago. So I'm going to sign off for this first video, try to get it up, and follow with another one, hopefully within 4 weeks, when I have a little more information about how I'm moving forward. Have a great 2019. I hope this helps out even a few people. Take care.